The following segment is sponsored by Northern Nevada Health System.
Welcome back to Family 411. We are here with Marlena Smoot. You are a labor and delivery nurse here, and we're talking about how to have a comfortable labor so far. I mean, it seems like that would be the main thing we want to ask when it comes to delivering our baby. So talk to us a little bit about why it's important to prepare for that big day.
So, comfort is not something that you would normally associate with labor.
Yes.
So we're going to say comfort in labor. So, you know, we have purpose in this to be able to get through this labor, and it is going to have discomfort. So we're going to try to create an environment where you can have the most comfort possible while you're going through a marathon, because truly it's a marathon. So the reasons that you would want to learn about positioning is not only for comfort in labor, but for your pregnancy. Creating a human being is a hard job, and
Yes.
your body goes through a lot of changes. So you actually want to be able to position yourself in ways that make it comfortable for you to be able to sleep at night, for you to be able to move, get in bed. And so you want to make space for your baby to be able to move within your body, because they are in a constant state of rotation, and we need to be able to use positioning for that to happen.
I'm sure there's so many moms that are listening right now going, yes, yes. Okay, so we're talking about these movements and positioning for delivery day, and it really kind of goes back to these exercises. What exercises are important for to-be moms to do?
Okay, so let's look at how we don't want our baby to sit in our pelvis.
Okay.
Okay, so this is what we call our little OP baby, meaning occiput posterior or sunny side up.
Yes.
And a lot of times these moms will look super thin. Their belly doesn't stick out a whole lot, because look at that, their baby's all lined up with their back. However, when this big head comes at their back, it puts a ton of pressure back into these joints, and it causes an abnormal pressure in the joints, and this is what we call back labor. We don't want this. So to be able to just help position your baby into positions that cause comfort in your body and help them to rotate through the pelvis for an easier labor, we want to do forward leaning positions. So when you're on all fours, you can train your baby to kind of hang out around the front here.
I didn't know that.
And when you train that baby to go around the front, even if they like to kind of hang out in the back, because some babies just do, when you start labor, if you've been doing your all fours at night, your baby will automatically take the heaviest part of its body, which is this bottom and the back of its head, and rotate into the bowl of your belly. This will be so much more comfortable than having your baby in your back.
So that's going to help reduce labor pains.
Correct. And this helps if you've been walking all day and you have all of these muscles in your back will actually shorten because your belly goes forward. When you go on all fours and you straighten that back out, it actually stretches everything back out again for you to be able to get into bed at night and be comfortable.
Marlena, I feel like you should have a class for this. Is there
Well,
one?
let me just tell you, here at Sierra Medical Center, I do have a class and I teach this, and this is my passion, and I do want women to have comfort in their pregnancy and in their labor, because there is a lot of labor before you actually get to the hospital sometimes, just to help those babies to get in the right position. Like I said, they're in a constant state of rotation. So wherever they are, they have a lot of lining up to do. Sometimes a couple of days before you would even come in and see us here at the hospital. So I have a lot of techniques that can help with that. But for sure, get a birth ball, be able to sit on a birth ball. If you have a desk job, sitting on a birth ball will put you in a nice straight position. Instead of, see these chairs that put us back in this position? Well, guess what? Every time you do that, where are you putting your baby?
Sunny side up.
Yep.
I feel like I need a birth ball all the time. Okay, so if somebody is expecting a baby or even family planning right now and they want to take a class, where can they go?
they can go to our site at Northern Nevada Sierra Medical Center and look up our prenatal classes. And right now they're free to anyone in the community. So just get on there and sign up. They do get full, and when they get full, you have to wait for the next class.
Okay, great information. We're gonna have all of that up on our website. Marlena, thank you so much.
Yes.
If you missed any of this and you wanna watch it, go to foxreno.com, just search Family 411.